Dr. Gray. It's so good to have you here. The fall is in the air, as you know. We have St. Charles Catholic Health. You're the first doctor to join us in this new series this fall. I'm very excited. I learned so much from these things. I have a question right off the bat. 60-year-old male. Here I am, specimen, right? I've never done physical therapy. How rare is that at 60 to not have done?
That's a very good question. I don't have an exact statistic on it, but I'd say you've probably taken very good care of yourself, that you have not needed PT for a knee injury or a back injury or for a more severe illness like a stroke or something like that.
So it's not like because I stay inside and I guard myself. Like just yesterday, I'm clearing brush in my backyard and I run into literally 2,000 bees. I was stung. I guess I'm not allergic. Which has nothing to do with physical therapy, but the point is, at any given time, I can be getting hurt. There was one time I fractured my arm pretty badly, but I don't remember any physical therapy, so I'm excited to learn with you. I know your background. I have at least two correlations with some of your education, Stony Brook, and then you did something at Good Samaritan, which is where I had all four of my children.
Yeah, so at Good Sam, I did my internship for 1 year, and then Stony Brook was my residency.
So where are you from?
Farmingville. I'm a Long Island gal.
Excellent.
Yeah. I pretty much stayed here most of my training, except for 1 year. I did my fellowship at Cleveland Clinic.
Excellent. So everybody knows the St. Charles name, especially in Port Jefferson. My brother was actually born there. It's been around a while. Tell us your services. You're medical director, of course, at St. Charles Catholic Health. We want to learn about the in and out rehabilitation services. Now, I always felt like I knew St. Charles did this, but there seems to be even more branding and awareness. We want people to know what they can achieve.
Right. So, I'm the medical director for physical medicine and rehab at St. Charles, and we offer inpatient and outpatient rehabilitation. So starting with our inpatient rehab, we take care of folks with all sorts of illnesses and injuries that would require being in the hospital to do their rehabilitation. So possibly after a stroke, traumatic brain injury, spinal cord injury, multi-trauma, all the way down to, let's say, a knee replacement sometimes or a hip fracture.
Okay.
And we offer physical therapy, which is getting up, trying to walk again, do stairs, all those really more physical activities. Occupational therapy, which is doing your ADL, activities of daily living, which could be like, how am I getting to the bathroom? How am I getting in and out of my bathtub? Those sorts of things to kind of navigate kind of the things we don't think about every day doing. And speech therapy for certain patients, they require assistance with learning how to swallow again or improving their speech function. So we also have other services available if needed. Psychology, of course, after somebody has a significant illness or injury that changes their life, it's important to have those services available, as well as us, your rehabilitation physician that oversees the care and rehab nursing. So.
Excellent. When we talk about in and out, is it always the case where somebody would start in and then progress to out?
Not necessarily. Some people might just go right home from the hospital and go right to outpatient therapy. Like, let's say you had a stroke where you maybe just have a little bit of balance issues, but you could get home right away. Somebody might go right to outpatient therapy. And or other injuries, of course, you wouldn't need to come inpatient at all. You wouldn't even go to the hospital for like a knee injury or something like that. You'd go right to outpatient.
Is there training, and if I don't have the right word, let me know, but do family members that are close to the patient, are they part of this rehabilitation process?
Yes, they are a critical part of the rehab program, and we do like to have families come in and be trained. We call it family training, to talk to the whole team and really make sure that the families can assist the patient once they've gone home.
Excellent. I was reading on the website, and I know you're putting out some new material for your services. This is a word I hadn't heard of yet. I want you to say it. Physiatrist?
So people say physiatrist or physiatrist, and that is what I am actually. That is a medical specialty. It's like more formally known as physical medicine and rehabilitation. So it is a medical specialty. There's residency for this. We have a board, and we are physicians that could do many, many different things. You might see a physiatrist and not even realize it, but the point of the specialty is to help people regain function, whatever that means.
Okay.
So some physiatrists go into pain management, sports medicine. Some people do what I do, which is more neurorehabilitation and inpatient rehabilitation, but there's a lot of paths to go.
So I want to mention this team approach. You also have physical therapists, occupational therapists, speech and language pathologists. Do I have that correct?
Correct.
Nurses, of course. Here's another one. Neuro psychologists, as opposed, or in addition to psychologists. We're going to come back to that, and recreational therapists. So tell me about that. So brain injury kind of a thing would be neuro?
Well, so neuropsychology, so psychologists are folks who can help people with supportive counseling, and that sort of thing. Neuropsychologists have like other training. A lot of them are PhDs who they get specialty training in doing cognitive testing.
Okay.
So when folks have some kind of illness or injury, brain injury, stroke would be the most common, where they now have a cognitive impairment due to that. Neuropsychology, might be indicated to come in and do a formal neuropsychological evaluation to see like where are the deficits. This is especially important in school-aged folks who
Okay.
now, like younger like kids, teenagers, people college age, who now might need some accommodation in school.
Okay. Dr. Gray, on a daily basis or a monthly basis, let's give our audience an idea of the kind of volume that St. Charles may do, and I know you have other sites.
Right. So for our inpatient program, we see somewhere between 1,200 and 1,300 patients per year.
Wow.
We have 10 outpatient therapy sites located across Long Island, and they serve different services. Every site has PT, some also OT and speech therapy, and part of our outpatient programs, also there are some specialty outpatient programs involved in that. For instance, we offer vestibular rehabilitation, which is a special type of rehabilitation that requires extra training by the PT. We offer Schroth therapy at some of our sites, which is a special kind of therapy for folks with scoliosis that they might be indicated for. We also have a very strong sports medicine program, and we offer recovery clinics for student athletes on the weekends during sports season. That's just kind of ramping up now.
There was a specialization we were mentioning before in concussions.
Oh, right, yes. So we have had our Think Smart concussion management program for well over a decade now, where we care for student athletes. We also provide baseline testing through some of the school districts. So St. Charles does offer that testing and we partner with about 40 different school districts across Long Island. And if there is an injury, then one of our docs can see the patients and help them recover.
So this is a big concern today, concussion management or trying to detour having a concussion. I guess sports may be faster, right? A little more aggressive. What are you seeing in terms of age groups? Is it high school mostly where you're seeing concussions?
Yeah, we actually at St. Charles cover a broad spectrum of concussions, not just student athletes. As the physicians and our therapy sites, we see, from younger kids all the way through adult, like the older person that might fall. But we do, during the sports season, we do see, a good amount of student athletes, both, even from elementary through high school.
So as a general rule, they say if you don't use it, you lose it, right? So, as we get older, I do find, for example, getting out of bed is not as easy as it used to be. You do feel the creaks and cracks. So what can one do just to stay on top of that? Because I would imagine as you get weaker, you can do something very silly like fall down a small flight of stairs because you misstepped because maybe you weren't moving enough. So where am I going? Is there preventative aspects to what you do as well?
Well, sure. So maintaining a healthy lifestyle is also important. A healthy weight, maintaining physical activity is important through adulthood. Having your regular checkups with your docs to make sure everything else is healthy. But also there are things to do around the house to prevent falls, and we do run a fall prevention program through St. Charles as well, and offer community lectures and such in that regard to help people and just give you pointers around the house, things you might not have thought of that could potentially lead to a fall or injury.
So, Dr. Gray, a team approach, very important. Again, from my point of view, I always knew that St. Charles was involved in this physical therapy and rehabilitation. How long has this been going on?
Well, St. Charles really kind of started as a rehab hospital when it started in 1907, when a group of nuns, the Daughters of Wisdom, showed up in Port Jeff with a bunch of kids with, various illnesses, including polio, and really started caring for these children. And I think through the decades after, you could see, St. Charles was really known in the tri-state area and beyond, I believe, as a place where kids can come and recover after illnesses and everything. I mean, all sorts of famous people visited St. Charles back in those days, we have the evidence on our walls and whatnot. So
a lot of history.
So it is, so it's a special place.
What about equipment-wise? I mean, you couldn't do some things at home because there's really specialized equipment. One of the things I might think about is like hydro equipment. Tell me about that.
So we have a lot of different specialty equipment. Our kind of, most utilized and important piece of equipment, if you will, is our whole downtown area, where we have pretty much like a little city developed down in that area, with an apartment that really replicates an actual living quarters, with a bathroom that's really like what people have in their homes, not the very nice accessible bathrooms that are in the patient rooms. It has a kitchen. It has a little community area. We have a full-sized car, so people can really transfer getting in and out of the car.
Why would you ever leave?
I know. Well, there's no engine in it, so you can't leave.
Okay.
But that, and we also have some specialty equipment. We have an overground walking device called Andago. We do have some specialized equipment for folks with spinal cord injury and other neurologic injuries, some special bikes that utilize electric stim to help get the muscles moving and help, keep people's circulation and everything going. That is really, people really enjoy it.
Dr. Jennifer Gray, it's been a pleasure. Thank you for joining us, really imparting some knowledge about what you do up in the hill there. Again, St. Charles Catholic Health is a member of the community for sure, always around at the Chamber of Commerce, the Health Expo, and many other events. And then, of course, you're there for the people that need you when they need you. Thank you again.
Thank you for having me.